Collagen cross-linking, CXL, is a treatment for patients with keratoconus, which can prevent their condition getting worse. It is successful in more than 90% of cases. Cross-linking uses ultraviolet light and vitamin B2 riboflavin drops to stiffen the cornea. Used together, they cause fibres within the cornea to cross-link or bond more tightly. This treatment mimics the normal age-related stiffening of the cornea. In general, CXL is very safe, but like all operations, your eye needs time to heal, and problems do occasionally occur. About 3% of patients will lose some vision in the treated eye as a result of haze, scarring, corneal surface shape irregularity, or infection. However, without cross-linking, at least 20% of all patients with keratoconus will eventually require a corneal transplant. Cross-linking is performed as a day case procedure by a senior ophthalmic nurse or doctor. Although the procedure takes approximately 30 minutes, there is usually some waiting time before treatment, and you will also need to stay for a short while afterwards so we can check that you have everything you need to go home. Please be prepared to spend up to half a day in hospital. Most patients choose to have their surgery under a local anaesthetic. This means that you are awake during the operation. In some cases, we will have agreed for you to have general anaesthetic instead. This will have been determined in advance, and you will have received separate instructions about what to expect and how to prepare for this. When you arrive, please register at the reception desk. One of our team will check your vision. Then, one of the doctors or senior nurses will come and see you. They will answer any further questions that you have and decide if you are happy to proceed with the surgery. They will ask you to sign a consent form and will place a small arrow on your forehead above the eye which is having surgery. You will be taken to the anaesthetic room, and a nurse will add some anaesthetic drops to numb the surface of your eye. You will then be asked to lie down on a comfortable trolley bed in theatre. The person performing the procedure will place a small clip around your eye to keep your eyelids open. This may feel slightly uncomfortable initially, but the discomfort should not last more than a few minutes. The surface skin of your eye is then gently brushed clear, and riboflavin drops are applied every few minutes for at least 10 minutes. Following this, ultraviolet light is shone in your eye for 8 minutes. A soft bandage contact lens is placed on your eye at the end of the procedure. A protective shield will be placed over your eye, and you will be helped off the trolley into the discharge seating area. You will be given eye drops to use after the procedure and instructed on how and when to use them. The soft bandage contact lens will remain in your eye until the surface has healed for about 7 days. If the bandage contact lens falls out during this time, please throw it away. Do not attempt to reinsert it. The anaesthetic drops will wear off later during the day of your procedure, and your eye will be painful, red and sensitive to light for several days. Your vision will be quite blurred at first, but will clear gradually over the first few weeks. It is normal to experience fluctuating pain within the first 2 days after surgery. However, if you experience increasing pain on days 3 or 4 after the procedure, this could be indicative of infection, and you should visit A&E. Please note that infection is rare, affecting fewer than 1% of patients. You should allow at least 1 week off work while most of the surface healing occurs, or 2 weeks if your job involves a lot of computer work and the treatment is being done on your best eye. Day-to-day activities such as watching TV or using a computer will not do any damage to your eye, but you may find it more comfortable to rest with your eyes closed early on. Many patients find sunglasses very helpful. It is important to put the eye drops in regularly as prescribed. Wash and shower normally, but try to avoid getting water into your eyes. You may exercise, but should not swim before the surface of your eye has healed. You will be given an appointment in the following week to check your eye is healing properly and to check if your vision is good enough to drive. We hope this video is useful and look forward to seeing you on the day of your surgery.